Hello, I'm Kenneth Hopland at Medical Care, and today I want to talk to you about some subjects which I think everyone is hot on their mind is COVID-19. And specifically, what I really want to talk to people about is COVID-19 testing. I think that the current news cycle has really clouded everybody's understanding, or the wide majority's understanding of what it is COVID-19 testing is, and what it can do for us and what it can't do for us. It's really important to understand these subtle differences and why physicians are doing testing at some times and other times we don't, because I know to the general person this can be real confusing. To understand when you might need a test, when you might not need a test, and what a test is useful for is really what I'm doing with this video. One of the things I want to talk about first is why might you want to get tested for COVID-19, okay? And I think those reasons are not as many as you would think. The first is symptoms. If you have symptoms of COVID-19, that is loss of smell, shortness of breath, cough, congestion, fevers, chills, general flu-like symptoms, I think in the world that we live in today, if you are not going to take the time to basically quarantine yourself for 10 days based on just having symptoms, I think that you need to get a test at that point in time, or consider getting a test at that time to be sure that you are not spreading this disease unwillingly. I don't mean by that if you wake up one morning and you sneeze twice, you need a COVID-19 test. I am talking about somebody who has respiratory symptoms, compatible with what we used to think of as a cold or maybe a flu-like, influenza-like illness. Times when I do not think a COVID-19 test is necessary is those people who are completely asymptomatic and have no known current exposure. In that scenario, just screening for COVID-19 with an antigen test really provides little, if any, information that is useful to either the patient or to a doctor in any way, shape, or form. And the reason for this is understanding what an antigen or a COVID-19 test is. It only looks for viral particles in your respiratory tract. If that is negative, so today if I got tested for COVID-19, that does not mean I will not be positive tomorrow. And it does not mean that I was not positive 7 days ago. It means currently, at this time, there was no virus seen or found on that sample that we obtained. That doesn't really give you any security for the future. And so if you came in to be tested saying, I'm going to be going out of town next week, and I want to be sure I did not have COVID-19, a COVID-19 test does not provide you that information. I have no idea if you're going to have that this week. If you were exposed today, you were almost certainly would test negative today. But yet, you certainly, it's possible that you may come up with symptoms in 5 days. So trying to use a COVID-19 test to predict whether or not you're going to have the disease in the near future is absolutely not useful. Another reason you might decide to get a COVID-19 test would be if you were exposed to somebody who had a known positive test. In that situation, let's say today is Monday and I was exposed on Sunday. Testing on Monday is of almost no value. All the data that we have looked at as far as testing and in the literature shows that 1 to 2 days after an exposure to a known positive, the false negative rate is right at 100%. In other words, almost nobody who's going to get the disease will test positive that early. Come day 3, 4, and 5, that false negative rate starts to go up to maybe 20% on day 3 and somewhere in the realm of 40-50% come 5 days into it. And so if you were to be tested because you were exposed and you are currently on your 14-day quarantine and you wanted to be sure that you didn't have this disease to let other people know who you've been exposed to, if you possibly could have spread it to them, you really need to wait until at least day 3, more likely day 4, day 5, if you have no symptoms. There is some question if you, let's say you have not really been in contact with other people as to whether or not you actually need a test. Because no matter what the result is on a COVID-19 test after exposure, you still need to remain self-isolated for 14 days. A negative test does not remove that requirement. If you were exposed on this situation on Saturday, you came in on Monday and you had a negative test, I would never suggest that you say, oh, go back to work. There's no chance you're going to come down with COVID-19 because I know you're negative because you were exposed on Saturday and you have a negative test on Tuesday, or even on Wednesday or Thursday. The problem with COVID-19 is the incubation period lasts quite a while. We do not know for sure that you're not going to get the disease until we literally get about 2 weeks out. Most people who are going to get symptoms are going to get it within that 5-day, 7-day window, but there are exceptions to that. And so we could not safely tell you, if you've tested negative for COVID-19 when you've come in with an exposure, that you are not going to get the disease and be at risk to others. Very similar to what I talked about if you're negative currently. It does not predict your future. It only tells you that there was no virus at that time, and so therefore you would have to continue it. We have had a lot of people come in with exposures wanting a negative test so they can go back to work. I really want to get this information out there. That is not a reasonable request. That will not be a reason that the doctor would say, go back to work. Now, a reason you might get a negative test and be sent back to work would be, once again, the symptoms question. If you had a cough, you get a negative COVID-19 test. At that point in time, unless you for some reason are higher risk for us to be really sure that you have the test despite your negative, in other words what they call a false negative test, you can return to work. We know that your cough is due to either some other illness, either a viral illness or allergies or some other reasons that you're having symptoms, but it does not appear to be COVID-19. But we need to remember, there is a false negative rate with all these tests. There is depending on the test we use and the swab that we obtained, there is a 15%, 20% chance that is a false negative test, particularly depending on what time your symptoms started and how far into it you are. There is no test that is 100%. It doesn't matter where you go, which test you get, 100% is a lofty target that no one obtains. And so no one can promise you had a negative test, you are no risk to others. We would say it looks likely you are not, but that's as good an answer as doctors can give you. Most people have struggled with this 14-day self-isolation. We know that is difficult. The idea of isolating yourself from others for such a long period of time because of a simple exposure, we know that's a big ask. I think that the Centers for Disease Control, politicians, doctors, we all know that is not something we take lightly. The problem we have had is not that people don't want to do that, it's that they don't understand the importance, or they understand that incubation period, and that they may become positive during that time. It is interesting for most people that you can have the disease and actually be at work sooner than somebody who is exposed and never gets the disease. And the reason for that is the illness often lasts a shorter period of time than the actual incubation period can be. So if I get COVID-19 on Monday, I may feel better by Friday. And if I feel better by Friday, I only have to wait 10 days from my original beginning of symptoms before I can go back to work. So I'm back to work on the following Wednesday. Someone who was exposed on Monday when I had the disease, they need to be out until the Monday after that. So I would be to work at Wednesday, and that person that was exposed to me on Monday wouldn't be back until the following Monday morning. So it seems counterintuitive to most people, but what they don't understand is that incubation period prolongs the potential for having that disease longer than you actually have the disease. And so that is something to think about and know. If you have exposure, you have to make a decision. Do I get tested or not? And really that depends on what level of exposure have you had to others. Because at that point in time, you're not getting a test for yourself. You're getting a test to see if you need to tell someone else that they need to quarantine also. Because that test is not going to send you back to work with exposure. So I hope that this has cleared things up a little bit. I know this is a difficult topic and a struggle for all of us. These times are strange, and heaven forbid that we have to continue doing this forever. I am hopeful that this will continue to wane and that we'll be through this time period soon. But I'll be honest with you, it's impossible to look into the future and tell. So God bless you, and I wish you the best. Have a nice day.